While holding the viscera of the stomach in position, we have to make sure that the superior surface it faces anterior as well as forward as well as upward. Then this abdominal part of the shoulder or the cardiac hill is usually to the right side of the median plane, and the pyloric hill is usually at the lower position and to the slightly to the left of the median plane. Now, anatomical points. The cardiac end of the stomach lies 2.5 centimeter left of the median plane, behind the 7th costal cartilage at the level of the thoracic 11th vertebra. The pyloric end lies 1.25 centimeter right of the median plane at the level of the lower border of the lumbar 1 vertebra. The superior surface of the stomach is directed forward and upward. The greater curvature of the stomach is convex toward the left and downward. The lesser curvature is concave toward the right and upward and forms the right margin. Parts of the stomach: 2 ends, cardiac end, pyloric end, surfaces, anterior superior surface and the posterior inferior surface. Then curvatures, lesser curvature, greater curvature. Now further it can be divided as the fundus, a horizontal line straight from the cardiac notch. Horizontal line straight from the cardiac notch, the upper part is the fundus, the main part is the body. But the body and the fundus, this angle, this is called incisura angularis, which is the most dependent part of the lesser curvature. From this incisura angularis, a line, 2 imaginary lines extending toward the greater curvature, one at the notch, one at this proximal notch and one at the distal notch. So this divides the body and divide the body of the stomach with the pyloric part. So this portion between these 2 notches, this first proximal notch and the distal notch, between these 2 portions coinciding with the incisura angularis is the pyloric antrum, and the remaining part is the pyloric canal. And this portion, the thickened portion, see this highly thickened portion is the pyloric sphincter, which is actually formed by the thickening of the inner circular muscle layer of the stomach plus the contribution of some deep fibers of the longitudinal muscle of the stomach. Look at the interior of the stomach. This abdominal part of the stomach, see. This is cardiac end. Now, along the lesser curvature, see, there are no muscles, no oblique muscles. So this is the gastric canal. Along the lesser curvature is the gastric canal. But we can see here a number of folds. These are the rugae, which are temporary folds, temporary longitudinal folds, means disappear on the distance of the stomach. And along the right free margin there, we will see that this side, the muscles, the oblique muscles of the stomach, the inner oblique muscle, they will be deficient along the lesser curvature, forming the right free margin, which are responsible for the formation of the gastric canal while swallowing any liquids or foods. Along the lesser curvature, more prone to the peptic ulceration, but along the greater curvature, it is more prone for the carcinoma.